A Target 8 investigation uncovering new details in the death of an inmate who suffered 17 seizures in the Muskegon County Jail.
We've learned one of the two women listed as nurses at the jail that morning, not a nurse at all, has never been one. And the for-profit company that provides medical care at the jail is under fire for inmate deaths and alleged poor treatment at jails across the country.
Target 8 investigator Ken Kolker breaking these new details tonight. Ken?
Paul Bolthouse's death on April 4th happened not only during the watch of the Muskegon County Jail, but also of an often sued Tennessee-based company known as Wellpath. Video obtained by Target 8 shows the Wellpath workers who were on duty at the jail the morning Bolthouse suffered 17 seizures and died. It shows a registered nurse checking through Bolthouse's cell window. Target 8 checked state records and found that she is licensed as an RN. Then there's this Wellpath worker making 2 reported window checks at Bolthouse's cell that morning. She also responded to his cell after a jail deputy discovered Bolthouse was dead. Sheriff's reports on the death repeatedly identify her as a nurse. Even the lieutenant who runs the jail in his report identifies her that way. But state records show that she has never been a nurse. She's a licensed EMT with far less training than a nurse.
An EMT should provide first aid, CPR, and transport people to a hospital in an ambulance. That's what an EMT is trained to do in their 81 or 90 hours of training.
Target 8 shared its findings with Mark Stern, a former health director for the Washington State Prison System and now a consultant and associate professor at the University of Washington.
It's hard to imagine good health care and dying of 17 seizures in a jail.
He says he's also troubled over what happened 3 days before Bolthouse died, when he bolted from his cell. Video shows Bolthouse's legs shaking violently after guards tackled him. That led a jail sergeant to ask a Wellpath EMT if she thought he was seizing. The EMT said she thought it was fake.
When a patient is having an acute change in their health, that needs to be referred to somebody who is licensed and qualified to deal with it. An EMT is not. If they looked into this case and discovered that an EMT was charged with making a decision of whether somebody was sick or not, I hope they would hit the roof.
There's no indication in reports that anybody consulted a doctor, though the registered nurse several hours before the death told jailers there was no need to send Bolthouse to the hospital. Stern says reports that the inmate's prior seizures were fake and that Wellpath workers were not taking them seriously could explain why a jail deputy watched one of Bolthouse's seizures on the morning he died, then walked away.
The expert said not to worry. The expert knows more than he does, and he trusted the expert.
Bolthouse suffered a dozen more over the next 2.5 hours before dying alone in his cell and in a puddle of his own urine. The Muskegon County Jail is among at least 11 counties in Michigan that pay Wellpath to care for prisoners. That list also includes Allegan and Berrien counties. Muskegon County Sheriff Michael Pullen has not responded to Target 8's public records request for a copy of the Wellpath contract, so it's not known how much the county pays. What is known, though, is that Wellpath has a long, troubled history.
Private companies do this to make a profit.
The Nashville-based company is the nation's biggest provider of health care to prisons, jails, and immigration detention centers, with revenues of up to $1.5 billion a year. Under its former name, Correct Care Solutions, it has been sued nearly 1,400 times in federal courts over the last decade. A Target 8 review of those cases shows 27 were filed in Michigan. In Colorado, a federal jury awarded a stroke victim $11 million. In Florida, a public defender demanded change after the deaths of 2 men and after a woman gave birth on her own in a cell. In a lawsuit eerily similar to the Bolthouse case, the company last year agreed to pay $4.25 million to the family of a man who died after it cut off his Klonopin cold turkey in a Colorado jail. Bolthouse had been taking Klonopin for anxiety for years, but Wellpath cut him off when he got to the Muskegon County Jail 11 days before his death.
If you're on that medication, I can pretty much predict that if you stop it suddenly, that person will continue to be very sick well beyond 5 days. We know that. It's science.
We reached out to both Sheriff Michael Poland and Wellpath for comment, but they did not respond. The Sheriff's Department had closed its internal investigation into the death, finding no wrongdoing, but reopened it in response to Target 8's report on the case 2 weeks ago.